Hi everyone, I am Nilesh Atole and today's date is 24 December 2024 and today's topic on pharmacovigilance casualty assessment. Causality assessment in a pharmacovigilance evaluate the relationship between drug and adverse event. It helps to determine whether the drug likely cause the adverse event or if the event is due to the other factor. Here is a concise explanation of the process. There are 5 points to looking in casualty assessment. First one is a purpose, second is a method, third one is a data consideration, fourth is a step assessment, and fifth is a challenges which are faced in the casualty assessment. Then first is a purpose. Purpose is to the identify potential adverse drug reaction to support regulatory in a decision making related to the drug and treatment to the patient, then and also guide the clinical action like discontinuation, further monitoring of the drug. There are two main methods to assessment the casualty. First method is a first method is a UMC WHO casualty categories. There are six categories of casualty assessment according to the WHO and UMC casualty categories. First one is a certain, clear temporal relationship and possible mechanism and response to the withdrawal of the drug. Second is a probable or likely, which means strong temporal relationship, possible mechanism, and unlikely other causes of the adverse event. Then third is a possible temporal relationship exists, but alternative explanation are also possible related to the adverse event. Fourth is a unlikely, which is temporal relationship inconsist or a more possible explanation exists. Fifth one is a conditional or unclassified. There are more information is decide decide to adverse event. Then is unaccessible and unclassified, which is six point, which is adequate information for assessment. Second method of casualty assessment is a Narjos algorithm, which is based on the questionnaires evaluating. There are temporal occurrence, challenge, de-challenge, reach challenge outcomes, then alternative causes, then dose response, dose relationship, then laboratory findings. Scoring the classifies casualty definite, possible, probable, or doubtful of the ADR event which is related to the drug. Then there are some other methods such as RUCAM, focus on the liver related adverse event. Then second is a Bayesian approaches, which is statistically probabilities of occasion. Then third point is our topic is data consideration. In the data consideration, patient specific factors, medical history, commodities, concert medicines, then drug specific factor known as side effect, pharmacodynamic, pharmacokinetic, event specific details such as timing, severity, and pattern of the adverse event. And fourth point is our topic is steps in assessment. First step is temporal analysis. Did the AE occurs after the drug exposure? Second is a de-challenge and re-challenge. Did symptoms improve after drug stopping or drug re-enter into the body? Third one is a consideration. Consideration alternative causes. Assess other potential explanations such as disease or other drugs which causes adverse event. Then is dose response. Dose response relationship. Is the adverse drug event is a dose dependent or dose independent? Fifth one is use exciting evidence. Check the literature database and previous reports for the similar cases. Then fifth is the challenges faced in a causality assessment such as limited patient data, confounding factor, polypharmacy commodities. Then is rare or delayed onset reaction. Such reaction are rare and they are take a long time to receive. Causality assessment in a pharmacovigilance, Pharmacovigilance is a vital patient safety, helping the identify, monitor, and manage the risk associated with the medicines. Thank you.